Hello there and welcome to Dr. Z's Health Education Project. I'm Dr. Zaidi, and in this video I would like to talk to you about diabetic retinopathy. Diabetic retinopathy is retinal damage due to diabetes. Now, a brief word first on this diagram on the right. Diabetes can be thought of as a disease that affects the blood vessels in the body. Basically, the high sugars in the blood over time can result in damage to the blood vessels in all the organs of the body. Starting with the feet, pointing here, patients get ulcers and neuropathy due to damaged blood vessels in the feet as well as in the hands. In the kidneys, diabetics get kidney failure or renal failure, and you may know some diabetics who are on dialysis or have to have a transplant of the kidneys. In the heart, diabetics can get heart disease or heart attacks. This is due to damaged blood vessels in the heart. In the brain, diabetes can result in damaged blood vessels causing a stroke. And in the eyes, patients get diabetic retinopathy. So let's look at the eye more carefully. In this diagram here, I have a picture of an eye. This is the front of the eye. This area is called the cornea. This is the lens of the eye. And this layer back here with these blue lines and red lines is called the retina. So the film that lines the back of the eye is called the retina. The very central portion of the retina, used for the sharpest vision, is actually called the macula. So light is going to be passing from the front of the eye, let's say from this direction, passing through the cornea, passing through the lens, going through the very front of the eye, and then landing on the retina, specifically the macula, which is the center of the retina, and that is how an image is formed, and then those signals are sent down the optic nerve to the brain. So in patients with diabetic retinopathy, these retinal blood vessels that supply the blood to the retina become damaged over time. Patients will develop small hemorrhages on the retina, like so. Patients will develop cholesterol and fluid leakage in the retina, and this will result in damage to the vision. So let's look at what is going on. So if I were to draw down here a blood vessel, like so, and inside of this we have blood. And you remember that blood has some solid components like red blood cells. Blood has cholesterol in it. Blood has water in it. So that's being carried by the pipes that are our blood vessels. And with diabetes, you can sort of, in a simplistic way, think that the disease causes damage to the blood vessel walls, resulting in basically holes in these blood vessels. So now, instead of the blood flowing into the blood vessels and down the blood vessels, the blood is going to be leaking out. Blood, the water that's inside the blood, the cholesterol that's in the blood, starts to leak out. So when you have these tiny blood vessels in the retina that have little holes in them, the blood leaks out, the cholesterol leaks out, and the fluid leaks out, resulting in swelling and bleeding in the retina, which contributes to blurry vision. Now, next I want to talk to you about some of the eye complications that result from these damaged blood vessels and diabetic retinopathy.